Good morning, dear students. Good morning, dear colleagues. Dear all, I'm going to talk in English. You usually hear me speaking in Greek, but this time it's a little bit different. So excuse all mistakes. Today, we are very honored to welcome Dr. Ajay K to our school. Dr. Ajay K is Senior Associate Dean for Postgraduate Medical at Harvard Medical School and Director of the Master in Medical Sciences in Clinical Investigation Program. He's a Senior Nephrologist in the Renal Division at the Brigham and Women's Hospital. Dr. Singh has spent over 30 years in program development and postgraduate teaching, both at Harvard Medical School and at the Brigham and Women's Hospital. Dr. Singh completed his undergraduate and medical training in England at University College London School of Medicine. He moved to Boston in 1987 for his clinical and research renal fellowship at Tufts New England Medical Center, which he finished in 1992 when he joined the Tufts University faculty. In 1998, he moved to the Brigham and Women's Hospital, one of the principal teaching hospitals of Harvard Medical School. His interests are in clinical research, with a particular focus on the anemia of chronic kidney disease, in clinical research, education, and program development. He is the author of over 200 original contribution and review articles. In education, he leads several CME, continuing medical education courses at Harvard Medical School, the Brigham and Women's Hospital, and the International Society of Nephrology. He has given many lectures nationally and internationally. He is the author, editor of 11 books in internal medicine and nephrology. Dr. Singh is a fellow of the Royal College of Physicians in London and has an MBA from Boston University. As we all can see, we all can hear, his expertise and knowledge in medicine have paved the way for many groundbreaking advancements. Let us extend our warmest greetings and our gratitude for his visit and thank very much Mr. Suras and Mrs. Motaki for all the arrangements. We do look forward to an insightful and enlightening interaction. We want to know what you learned in becoming a doctor, and please join me all in welcoming Dr. Singh to our school.
Okay. So, thank you very much. I just want to particularly give my thanks to Dr. Sules for inviting me to Greece, my first visit here, and to the head of the school and the leadership of the school for your warm welcome. I really, really appreciate it, so thank you. When I was planning to give this lecture, I shared with my wife, who's a teacher, a school teacher, that I was planning to give this lecture on what it takes to become a doctor. And she said, please don't scare the students. Tell them that it's easy to do this. So I said, well, I'll try my best. So I wanted to first start by asking you, how many of you have an intention to go into science or a science subject? About half of the class, right? And how many of you have some aspiration to become a doctor? About 10 or 15. And how many of you have any knowledge about medical schools or universities in the US? In the US. How many want to go to the US to visit? Good. There are about 30 or 40 students who haven't raised their hand, so I'm not sure what you want to do. But what I'm going to do is to talk to you about lessons I learned in becoming a doctor. They are my personal opinions, and you may disagree or agree with them, and we'll obviously have questions. You can challenge me on these. So the bio roughly summarized my background. I grew up in London, England. When I grew up, the UK was not part of Europe. After I left, it became part of Europe, and now it's not part of Europe again. So things have changed over the course of the 50 years or so since then. I did my high school in London, and I went to medical school in London many years ago. You can see that. I went to medical school in 1978. I bet you none of you were born at that time, but that's when I went to medical school. And then I became a member of the Royal College of Physicians, moved to Boston in 1987 for specialty training in kidney disease. And then since 1998, I've been at Harvard and at Harvard Medical School. And what I'm going to share with you are the lessons I've learned in this. But before I do that, I want to tell you that there is a very important 2 words in my talk, and that is becoming a doctor. Becoming a doctor is like any other vocational profession. You become this person. You live this life 24/7. It's a life that is associated with a tremendous amount of respect. In Greece, you have the father of medicine, in fact, Hippocrates, right? And a big culture of excellence that dates back from that period of time. But the most important thing, or one of the most important things that Hippocrates talked about was professionalism, right? Professionalism. And so the medicine is a noble profession, and you not only help people, but you also enlighten them about health-related issues. So becoming a doctor is an important thing to think about. And it's no less important as becoming a lawyer or becoming an engineer, but becoming a doctor is a profession. The first lesson I thought that I would share with you is, don't expect training to become a doctor is easy. So for those people who want to become a doctor, understand that the journey is not short and easy. It's a long journey. But I would say it's worth it. Most people think that this is how you become a doctor. It's a really easy thing to do. You get on your bike, and before you know it, you're at the goal, your destination. Actually, it's a bit more like this, right? There is lots and lots of work that's involved in it. There are a lot of challenges. Many of these challenges are rewarding, and you benefit from them, but it's not straight. It's a straight line. There are examinations. There are various sorts of things you have to deal with, juggle your time during your training with the work that you do at home, your family, and so on. So medical school training is rote learning meaning you learn concepts. As a medical student, you have to learn things like the anatomy of the body, right? How can you operate on a person without knowing all the anatomic features and know them like the back of your hand? You need to be tested on that to make sure that you actually have absorbed that information and mastered it. And then, of course, medicine is a social profession. When you go to your doctor, you as a patient are judging your doctor by how they appear to you, how they speak to you, how they share with you what is going on with you, and how they recommend you should be managed. So you have to learn social skills. The other thing is that medicine has changed dramatically in the period of my career. There is now the rapid pace of knowledge generation. In the 1950s, medical knowledge doubled every 50 years. It took 50 years for medical knowledge to double. In 2020, it takes just 0.2 years for medical information to double. So knowledge is changing so rapidly now that you can't store all of this in your head. What we learned in the first 3 years of medical school will be just 6% of what is known at the end of the decade from 2010 to 2020. Just 6%. What I learned in medical school for the most part, in the first year of medical school, you will be learning in high school. It's just medical knowledge is changing constantly. And so this shows you the number of papers that are published. So you see in 1907, 0.06 annually published citations. In 2017, 27. So you can see the tremendous growth in knowledge. And if you ask me what Harvard Medical School expects people to do is to learn less facts now. Our students know less facts in medical school than they did now than they did 30 years ago. We don't expect them to know everything. We expect them to know how to get that information from smartphones, computers, from machine learning, artificial intelligence. These programs at the bottom there are up to date, a program which virtually every doctor in the United States refers to with respect to what to do in a particular situation. This was developed at Harvard. It is what we use now because we can't store the most up-to-date information in our heads anymore. It's too much. It's too much. So you have to now use technology more than we did before. So in order to be a successful doctor, you have to master some of the things in technology that other specialties take for granted. There's also globalization. If any of you have traveled around the world, you'll see, and this particularly so during the time of COVID, but even before COVID, there was the Zika pandemic, and there was the MERS pandemic in the Arabian Peninsula, and of course COVID. We are now finding that diseases are spreading from all parts of the world. COVID started in China, but before we knew it, within 6 months, it had impacted everywhere in the world. So disease has become globalized. Information is globalized. Information is globalized now. We are much more aware of what's going on and what diseases happening in other parts of the world and have to become experts at it than we did. I have to know, for example, about diseases that are prevalent, highly common in other parts of the world because people travel to the US. They present themselves to our clinics with diseases that we have no prior expertise on because now international travel is so common. And then the skills. At our hospital now, if you go to the clinic, we see patients and have to be expected to communicate in 8 to 10 different languages. We use translators, but the person who comes to us sees us in clinic. I sit there and we have a video conference with a translator who speaks another language. Spanish, French, Creole. All of these are languages that we interact with our patients more commonly now than I did when I first became a doctor. So there's been a tremendous sense of globalization. And then, of course, as you can see here, the other frontier, artificial intelligence. Artificial intelligence is going to be the future. If you look on this side, on the left-hand side, you see the year 1000. The printing press was between 1400 and 1500, and then see the progress that's happened since then. The Industrial Revolution that started in the late 1700s into 1800, and now we have the artificial intelligence revolution. I can tell you that sitting here 5 years from now, you will not be communicating with your healthcare providers directly first. You will be communicating with a chatbot. That's what happens right now in our clinic in Boston. If you call my clinic, you speak to a computer first. It'll ask you, what is your problem? You tell them what the problem is, and then it will ask you questions related to that problem to try and triage what is the level of severity of your disease. And then it will decide where your phone call needs to go. Should you go to the emergency room as an emergency? Should you go to a clinic? Should you go back to your general practitioner? That is all being done using artificial intelligence. In my hospital now, radiology images are first being read by an AI device, an AI program. Likewise, pathology. After tissue biopsy is done, an AI algorithm reads the pathology before a doctor actually looks at it themselves. This is all that's happening today. New drugs are being developed with artificial intelligence, more so than any other technology. So AI is the future. It's starting now. We are impacted by it, but we will not have seen the whole impact of this for the next 5 to 10 years. This is what I just saw when I came on the flight. This was a few years ago. If you know, at an airport, this is an airport, you can see cleaning was being done by a man, a human being. That changed, sorry, what happened? That changed to this machine, right? Many of you have seen this machine wandering around, somebody sitting on it, cleaning the floors. This is what I saw just recently, a robot run by an AI algorithm. You see this? It's without a human being. The robot experiences a person who's waiting to get on walking down an airport terminal, stops, sees this person, takes a left turn, and carries on. This is being done by artificial intelligence now. Simple cleaning tasks. So it's impacting even our daily life, right? Artificial intelligence. This is the revenues for artificial intelligence from 2016 to 2025 in the US. In 2016, it was $357 million. It's going to be somewhere in the range of $31 billion in 2025. The artificial intelligence impact on society is going to keep going up, 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 and up. And so that's going to be an important aspect of becoming a doctor. How you manage it. And the skills are different. The learning will be different. You, as a doctor, will have to learn computer programming, computer language to understand the outputs from all of this. That's going to be part of what becoming a doctor involves. Lesson 2, I think, in becoming a doctor is, as I already talked to you about, which is you need persistence, resilience, and determination, and a growth mindset. That's what becoming a doctor involves. That's what it's involved in the last 10 or 15 years. So if you look at this, becoming a doctor, what people see is you at the top. That's what you're going to be when you're a doctor. That's what my colleagues here, Dr. Veselos and his wife, are. But at the bottom of this is what you don't see, what it takes to become a doctor. Dedication, hard work, discipline, disappointment too. Not everything you want you'll get right away. Sacrifice, failure, persistence. So think of becoming a doctor like an iceberg. There's a lot that it takes to become a doctor, and these are things that you are learning in a great school like this, right? That's what schooling teaches you. Schooling teaches you how to be a hard worker, how to be disciplined, how to sacrifice, how to be persistent, and this is all very important skills to becoming a doctor. Because at the end of the day, becoming a doctor, there are many people on the way to becoming a doctor who'll stop you, who'll criticize you, who'll say, no, you don't need to do this. You have to be persistent and you have to be determined to do it. The type of mindset has changed since I was learning to be a doctor in the UK to what it is now, what I teach our students. The fixed mindset is, I know it all. This is what it's in medicine called opinion-based medicine. When I was learning and doing my training, people had a specific way to manage cancer. These patients need to have surgery, these patients need to have medical therapy. This is what I've always done in my practice, was what people said. Now, it's much more evidence-based. What has the data shown? Not just what your opinion is and what you've done in the past. You, in a fixed mindset, exploring and trying to understand is not part of the deal. In a growth mindset, you learn from others, you welcome feedback, you can train your brain, and you get better by working hard. And you use mistakes as learning opportunities. That's a growth mindset. That's what you will need to be good at, and I think that's what you'll find a school like this will teach you, the growth mindset. Lesson 3, the faster you learn the skills of collaboration and teamwork, the better. Collaboration and teamwork in medicine has been something that was not emphasized when I started my medical career, and is now part of the game. Today, in my hospital, I don't round and see patients on my own. I see them as part of a team. We have in our team a nutritionist, a social worker, the nurse comes with us on the rounds, we have a discharge planner, we have a pharmacist. There's 6 or 7 people who round and see every patient. We're working together as a team and we collaborate with each other. That's part of what medicine has become. And so you see collaboration. If you look on the vertical axis, you see the purpose on the vertical axis and the level of commitment on the horizontal axis. And you see that collaboration is not conversation. It's not going and talking to someone while you're on a soccer field. It is about really the highest level of collaboration. It takes time and work to collaborate with people. It requires you to have win-win solutions to how you work with other people. And that's part of what healthcare and medicine now has become. It's become a team sport. And that's why the education that you get in high school and in elementary school is so important, because that's what sports are about. Team sport. You work with others. You collaborate with others. You connect. I didn't learn to do this when I was in medical school. On the right are the connections that you can form. You can see how the nodes are, and you connect. In the red little dots are the connections you have. On the right-hand side are scientific meetings where you have posters where you share your research, your clinical findings, and your experience, and you meet other people. So connecting is now what's driving science in medicine, much more so than it used to when I started. This just shows you the collaborating in terms of countries that are collaborating, and you see different countries at the top, and I'm sure you'll find Greece on this list, but these are the collaborations that happen between countries in science. And so that's another part of medicine that I have recognized that's important as you become a doctor. Teamwork is essential to medicine. How you fit in, how you work with other people, that's a critical part as a lesson as well. Teamwork, as you know, is defined as the ability of a group or a team to work together as a single unit to achieve a common goal. That's what teamwork is. And as I said, teamwork is critical. I didn't realize it when I graduated from medical school. I have had to learn how to be a good team player as I progressed in my career. So I'll share with you this little experiment. I think you'll find it curious. So in America, there's a university called Purdue University. And this gentleman, William Muir, was a professor. And he decided to ask the question, what factors make chickens lay more eggs, right? Simple question. You have chickens. He wanted to know what factors make chickens more productive, right? As you know, chickens live in groups, and Muir divided a flock of chickens into two groups. One group was group one, 9 chickens, just randomly selected and left alone for 6 generations. And he measured egg production during those 6 generations. In the second group, he selected the most productive chickens for breeding, those who produce the most eggs, to create a super flock or super chickens. And he asked the question, which of these two groups in aggregate generate more eggs? Does anybody want to tell me what the right answer is? Just raise your hand. Come on, guys. Yeah, go ahead. The second one, the super chickens, lay more eggs. Anyone else? Yeah, go ahead. Super chickens. Super chickens. Anyone else? All right, yeah, go ahead. The first one, why do you think the first one? Why does it make more sense?
Because, I don't know, maybe they were like, when they were all together, they were more intimidated by the ones by the super chickens.
So the super chickens might intimidate each other, whereas if you're randomly selected, you might be more together. So let's see what the answer was for this. So after 6 generations, group 1 was up, and group 2, Group 1 was doing fine, plump, fully feathered, egg production had increased 160%. In group 2, all but 3 super chickens were dead. All but 3 super chickens were dead. They had pecked all of the others to death. The individually productive chickens in the super flock had only survived and achieved success by suppressing the productivity of the rest. What's the lesson from that? The lesson from that is working in a team is what's important. It doesn't matter necessarily whether you're a super chicken or not, it's whether you can work well with everyone else. And this experiment actually has been replicated many times. If it works for chickens, I think it probably will work for human beings too. We're more competitive than chickens, right? So creating a highly functional team is not just a matter of selecting the best individuals was the lesson. A good team requires people working together to create what cannot be produced alone, or at least to refrain from exploiting each other. That's what teamwork is about, right? Then there's another thing that I learned, which I didn't know when I started medical school, and that's the importance of teaming. So we know what teamwork is. I defined it. What do people think is the definition of teaming? Anyone? What is teaming? Yeah.
Someone you get to work with when you have to do research.
So who you work with together when you do research? Okay, hold that thought. Anyone else? Yeah. You have to speak up, sorry? So you work with someone else together. Well, actually, the interesting thing is teaming is really teamwork on the fly, and it's very important in healthcare, in medicine. If you're in the operating theater and something bad happens, like, for example, this happened to one of my colleagues who's a surgeon, the clipping machine that clips misfired, and it clipped and opened a major artery by mistake. Out of the blue, this patient was bleeding tremendous amounts, so the surgeon put his finger on and tried to prevent the bleeding, to control the bleeding. And this surgeon is a transplant surgeon. He has obviously skills in vascular medicine, but he called in the vascular surgeons to come in to help him. Teaming is suddenly putting a team together in a critical moment to try and get something done, right? This happens in plane emergencies. You know, the flight attendants usually don't know each other. They don't work as a team through their jobs. They depend on what their schedule is and what their rota is, etc. They all know what their jobs are, but they don't necessarily work together prior to on that flight. And they certainly don't know the chief pilot or the first officer. If there's an emergency, they all suddenly have to work together. It's teamwork on the fly. And situations complex and uncertain, full of unexpected results that require rapid changes in course. It happens in medicine. It happens in other parts of life. In medicine, another example is cardiopulmonary resuscitation. Most hospitals have a team that's not a stable team, different people because of different on-call schedules. There's no team culture. Teaming is when you get together because you're trained to do what you're doing. You need to get up to speed quickly, you require people to cross boundaries. You don't have any chances to get to know each other's strengths and weaknesses or work styles. That's teaming. And so that's another thing that I learned at becoming a doctor, that it's not just a stable team you work with. You have to learn how to you have to know how teaming works, how you collaborate with each other and do it in high-pressure situations. That's a skill that you will end up learning. It's a bit like if suddenly you're on a soccer field and your coach says, okay, rather than having these two pre-existing teams, I'm going to mix everyone up, now you work, now you play the game. You don't know each other's strengths and weaknesses, but you basically learn and start working together because of what you know your training is and your work positions are. Lesson 4, skills that are needed are changing now. Skills that are needed are changing. This is what I didn't realize either. This, in 1969, 1980, it was still pretty reasonable to think that routine manual and routine thinking skills were important. In 2000s, complex communication and expert thinking is what's valued in the workplace. The ability to think and problem solve is becoming what we are now emphasizing. As I said, at Harvard Medical School, we teach medical students now not rote knowledge. We teach them how to approach problems, how to deal with problems, how to problem solve, clinical scenarios, expert thinking, and complex communication. So 21st century at Harvard, this is Harvard, the medical school. The bottom here, if you come to Boston, you'll see the quad with the university medical school. Revamped undergraduate medical curriculum. Students have less knowledge at their fingertips than they did before. You use technology to access information. We teach problem-solving skills. That's what's emphasized in education now, and what we've started to learn. And then last but not least, doctors are expected to manage their brand. Just as you as students are managing your brand, right? Right? So my 15-year-old daughter, she wanted to buy headphones. And I said, what headphones are you buying? She said, I'm buying Beats. I said, why are you buying Beats? She said, that's what is currently popular in high school. Beats. Not Bose, not Sony, Beats. Because they come in different colors. You know, that's popular. She was managing her brand. This is what's part of her brand. Kids like wearing hoodies, right? Because that's part of their brand, or shorts, or whatever. Well, doctors need to manage their brands, and that's what you learn while you become a doctor. So appearances are important. Which person, can you tell about these people in this picture? You can tell a number of them are bored, a number of them are worried. How you manage your brand is important. Body language. Are you sitting like this? A closed body language, or you're open? Managing your brand. That's part of managing your brand. What you wear. This person, does anybody know who this person is? Everybody knows that, right? Steve Jobs, late. From 1998 to 2010, before he died, he never changed his appearance. His appearance was identical over literally all these years. What you expect from your doctor is the ability to manage what they look like, how they talk, how they conduct themselves, right? That's what I learned in med school. How you appear to the world is important. So in summary, I think that there are 5 lessons that I've learned in becoming a doctor. They're on this screen here. Training to become a doctor is not easy. It is not like biking on a flat surface to your destination. Not by a long stretch. There are many hills and lakes and other things you have to endure. So that's number 1. The iceberg illusion. Lots of things go into becoming a doctor. Many of those things you are going to learn in school. They're going to be part of what you learn here that will inform how well you cope and how you are able to become a professional, not just a doctor, an engineer, a lawyer, whatever you decide to do. But it requires more than simply just doing it. Collaboration and teamwork and teaming as a concept are really important. I learned that. I had no idea about that before I went to med school. And even early on in my medical career, wasn't emphasized. When I started my medical career, consultant physicians at the top would go on their own. We were the prima donnas. What we said was done, no questions asked. Now we work together in a team. Teamwork and collaboration have become the central part of how we function. Changing needs for skills, complex communication and expert thinking. As a doctor, you have to become good at that. Problem solving. It's now being taught in medical school. And then doctors are expected to manage their brand. You have to not only speak like a doctor, look like a doctor, but you have to behave like one. Just like you are in school. You know, you can't just, at least when I don't know about this high school, but I think in most high schools, there are rules. I'm sure there are rules here too. And you have to follow those rules. So in medicine, when you become a doctor, there are certain said and unsaid rules, and you have to manage that. So I want to say thank you, and I will open it up for any questions you might have. Thank you again.
Thank you so much for your presentation. It was an honor for us to have you here. We have some questions. One of them was already answered, so we're not going to ask it. The first one is, being a good professional means not just bring the latest in scientific discoveries and new technologies in their day-to-day work, but also ensure that their skills and expertise are made available to communities in as equitable and inclusive manner as possible. The question is, how do you ensure and protect and ensure those values?
Yeah, so I think you're absolutely right. It doesn't have to be a doctor who has to give back to the community. Every one of us has a duty to give back to our community, right? Every one of us. How you give back happens in many different ways. Some people donate money, some people donate their time, and others donate their skills. And as my personal approach to this was that I have donated my skills and some of my money, but it's very important in whatever profession you ultimately go into, give back. Give back. That's important because it's part, and giving back can include not just your community, but it can also be part of your legacy. Your legacy is something that you leave behind after you've gone. So whether it's having trained someone or mentored someone to follow in your footsteps, or it's by doing the sort of things that people do to support their community, legacy is also very important.
Moving on, serving, advocating for changes to structures and systems as the circumstances and environment require are the main vision of being a leader. Now the question, according to your experience and knowledge, what does being a leader mean?
Well, so the question is really about what types of characteristics define being a leader and what is required to be an effective leader. In my experience, and you know this, you see there are different types of leader. We are currently in the United States in the midst of an election, as you know, and we have two types of leaders that are standing for election, as you know, and they represent very different styles of leadership. One of the people says, I'm going to be a dictatorial leader. I'm going to tell people this is how things are done. The other one says, I'm going to be a servant leader. I want to serve the country. Very different styles. Turns out, in the polls, they're about 50-50 in terms of attractiveness to the people. So it's not like there's a uniform sense of what appropriate leadership should be. Leadership, or a leader, is defined as having the skills and the characteristics so that people follow you, to do things that your values embody, that they think are necessary to do, right? Not every type of leader and not every type of leadership is appropriate for a certain scenario. So for example, if there's a fire, you need a leader who can be very task-orientated and tell people this is what you need to do. Very much authoritative, right? That's what the context requires. But in higher education, like where I work, we have the style of leadership in higher education is adaptive leadership. Adaptive leadership is you're working part of a team, you develop consensus, and you lead through influence, right? So different types of leadership. I don't know which is the best one. I do know that in our institution, we found, specifically in our institution, adaptive leadership is the right way to go. Yeah.
So now we're going to have some questions asked by our classmates.
Okay.
So you can raise your hand if you have any questions.
Is it hard to balance your personal and professional life?
Is it hard to?
Balance your professional and personal
Work-life balance. I'm actually the wrong person to ask that question because I don't have much work-life balance, right? So it's hard. It's true. Is it important to have a work-life balance? Absolutely, it is important. When I started my career as an immigrant into the United States from the UK, my goal was that I needed to be a little bit better than everyone else to succeed, right? So I had to work harder, accomplish goals more quickly than my other people in my class, right, when I entered. As I've gone through, what I've recognized is that that really for a balanced life, for a life that is filled with sort of enduring success, you need to have work-life balance, right? So there are two Harvard Business School professors, Laura Nash and Howard Stevenson, that have written extensively. They've got some books out about this, and you can read about them. You can pull their articles and books from the internet. But these two professors have come up with a concept called enduring success or lasting success. Their point is, if you are like me at the beginning of my career, you're on a treadmill, you're constantly working hard, you have nothing else that you do and devote your time to, that will ultimately lead to burnout. And about 50% of doctors in the United States complain of burnout. What they've introduced is a concept that for enduring success, for success that lasts, you should have 4 things that you have as part of that, right? Do things that you're happy in, right? And happiness encompasses not only happiness at work, but happiness at home. You know, be contented. The second is achievement. Of course you need to achieve things to be successful. And achievement is defined as how you measure up in accomplishments to your peers. The third one is significance, that in order to have work-life balance, you have to have significance not only in what you do at work, but also what you do at home, right? To bring up children in a good way, to give back to your community, to spend time doing things that are worthwhile, significance. And the last thing they talk about for enduring success is legacy. We talked about that. How you do things that kind of help others, your community, people that are coming in your footsteps behind you, whether it's your children or others. And so work-life balance, I think, has to be looked at through the lens of how do you succeed over a long period of time. Of course, most of us would love to spend most time at home and not spend time at work. You're not going to be successful. You have to have balance. But what you balance it with and what you choose to do has to be very strategic, right? Okay.
Any other questions?
What would be your advice to anyone wanting to join med school but not being too sure about it?
The first thing you have to, well, first thing, I grew up in a family that had no doctors. So I didn't have any family role models, right? And I was like you, thinking, well, I want to do medicine, but I don't really know what it's about. So the first thing I did was I did voluntary work at the local hospital to try to understand what it's like to be a doctor, right? Actually, my first experience was pretty scary. When I started at university, I did voluntary work at University College London, at the hospital there, and the first thing they did was say, can you draw blood from this patient? Go to ward X, bed such and such, and draw blood from this person. So I went to, and I had been trained a little bit in this already. I put the tourniquet around, put a needle in, take blood, and once I took the needle out, the patient would not stop bleeding. And I was super scared, right? What do I do now? Panicked, in a sense, in my own head. But it was a good test, right? So what did I do? I put my finger on the thing, waited for a while, and a nurse came by the bedside who was very kind. And this nurse said, this person is on blood thinning medications. So it's not at all surprising that, and her skin is very fragile, and there isn't any soft tissue around to prevent the bleeding, to stop the bleeding. Don't worry, we're going to put a pressure bandage on this to stop it bleeding. And to me, that was my first experience. But I liked that there was a little excitement. I was dealing with people. I didn't faint because of the sight of blood. I survived that. And I like the idea that there's a mixture of science and clinical work and helping people. So I think volunteering is a good idea, something to consider. And I don't know how easy or difficult it is here in this country, but even in the US, people are doing it. My son, who wants to be a doctor, is just graduating from college, and he's starting work at an old people's home, just to help, to see helping his people and interacting with people is something he likes doing, right?
Okay, so how do you deal with the grief when you're losing a patient or when a patient is in a terminal state?
How do I deal with a person in a terminal state?
Yes.
I do not think it's easy. There's a lot of skills that you learn in how to deal with it, the situation. There are three things I think that are really important with someone who's terminally ill. On the one hand, you have to be objective, right? You have to have a certain amount of detachment from the situation because that's what you're expected to do, to be a little bit thoughtful about what the facts are and dealing with the facts. A person who has a terminal illness often has needs that are medical that you need to address, pain management, lack of energy, the mental aspects of coming to nearing the end of their life. So that's one very important aspect of it. The second is compassion. You have to understand and have empathy and be compassionate, know how to speak and address and understand the person's psychosocial needs. I deal with a lot of patients who have kidney failure, and some of them have terminal illnesses. I'm not an oncology surgeon like my colleague here, who probably deals with it somewhat more frequently, at least in some patients, but I deal with it too, and it's not easy. But you do need skills, they're complex skills, and it's a combination of being objective, and it's a combination of having compassion.
Okay, so what makes you more happy as a doctor? What makes you happy?
What makes me happy as a doctor? It makes me happy to come to places like Greece and Athens. That's great. But I think having a life that is fulfilling, I do a combination of things nowadays in my job. I do research, and I've been fortunate enough to have published papers that have developed therapies or defined certain types of therapies so that they're better and more useful to patients. So that's helpful. I think that's important to me. I take care of patients. That's very fulfilling. I do a lot of education, teaching people. I think that's part of a legacy. But I try to have time for my family too. And it's hard. You have to juggle all of those things. But what makes me happy is the ability to have varied life which has different elements to it and juggle them and manage them together. I wouldn't have done anything else. I don't think there's a day that I have woken up feeling down. Every day I feel this is going to be another great day. So far. Who knows what the future holds.
Okay, so we're going to have one last question.
So, how do you think AI is going to change the world of medicine, and are you scared of AI?
I think that AI in medicine and healthcare is going to be very, very transformative. I'll tell you where it's already affecting people. So, for example, we have to look at admissions of students to our master's program and to medical school. And each student is expected to write a personal statement. And I'll be truthful to you. We can't easily figure out whether someone has used AI to write their personal statement. Simple. So we ask our students to do essays as part of their term papers and to do thesis documents. They're using AI without attributing that they've used AI to write it, and that's creating competitive pressure. If 3 students are doing it, everyone is starting to do it, right? So in the area of education, AI is scary till we get regulations around it, right? Image manipulation. AI can, as you know, create pictures, and it can create scientific pictures as much as anything else. So when you want to publish research, if some of the pictures are generated through AI, like gels from from a study of a protein or genes to figure out what's real and what's not, it can be challenging. In healthcare, AI is having an impact. The positive impact is in creating new drugs, right? So there have been some new drugs that have come on the market that had previously been dismissed because AI algorithms have identified them for other purposes, not for the ones that were originally developed. So they look at libraries of compounds and see whether there are pre-existing drugs that have been tested for other purposes that can be repurposed. And that's starting to emerge. AI is looking at image manipulation. AI is looking at billing. AI is starting to identify patients for clinical research, for trials, figuring out who is the best person suitable. There are many things that AI are going to do in healthcare that are going to be incredibly useful. They're already being done. But there are also scary things when it's misused and inappropriately used. And therefore, there's a lot of work going on to try to regulate it now. Because unregulated use of AI can be quite scary and can be quite harmful to society as a whole.
So, Dr. Singh, thank you. Thank you very much for your insight, for your presentation, for everything. We had the chance to learn. Your 5 lessons when becoming a doctor are for us life lessons, and especially for our students, and we are really grateful that we had the chance to listen to you. So please accept with all our gratitude a small present from our school community. And I think we can all keep that there are no prima donnas and that teamwork is the most important thing to achieve in everything. Thank you. Thank you very much, Dr. Singh. Thank you.